the Planet Elevate AI podcast, where we explore the future of artificial intelligence and how it transforms the way we work, connect, and succeed. Today's guest has a resume that could fill a tech encyclopedia. James Bates isn't just the CEO and founder of AdviNOW Medical, he's the mind behind the world's first AI and augmented reality-driven automated medical visit system. From conceptualizing the vision and writing patents to building high-growth companies and leading billion-dollar turnarounds, James has been at the cutting edge of AI, AR, and medical technology. He's also fluent in Japanese, a leader in AI for healthcare, and an expert in building bridges across industries. Perfect for today's theme, breaking down silos with AI. James, welcome to the show.
Thank you for having me. Appreciate it, Imran.
Great to have you here. Before we get into the big questions, James, can you introduce yourself to our listeners in your own words and share a little bit about your journey?
Sure. My name is James Bates. I'm the founder and CEO of AdviNOW Medical. I've been in the high technology field for 30 years. Out of school, I had the opportunity to join Bell Laboratories. At Bell Laboratories, I worked on the world's first integrated GPRS, or digital cell phone chipset. My specific part was the voice band, and that chipset ended up shipping billions of units over the next few years. I then moved into a startup named Silicon Laboratories, where I founded the international operations. We grew that business from zero to about $500 million over the space of about 3 years, and I lived in Japan when I did that. So after living in Asia for a total of 12 years, I moved to the Bay Area, and I worked for a company named Maxim. At Maxim, I had the opportunity to work with what most people would understand as Internet of Things or IoT type of devices. I made the sensor interface devices that are used in cell phones, used in smartwatches like the Apple Watch, or used in other Nest devices or anything that you can think of that takes very precise measurements of the real world and converts it to the digital world. I then moved to Arizona, where I live now, and I worked for a company named Freescale. I ran a billion-dollar business that was self-driving vehicle technologies. We made the technologies that Google Waymo, Tesla, Daimler, GM, any of those companies use to implement their auto brake or auto steer. Well, after we sold the company Freescale to NXP, which is a European company, I retired. As an officer of the company, it was a good time for me to retire. At which point, I had a very strict non-compete. I could not do anything I had done before. So, in lack of a better term, I could do anything I ever wanted to do as long as it was something that I've never done before. So healthcare was very different. I looked at healthcare and thought, well, this looks like something that would be very interesting to do because the healthcare system is broken. It costs too much money, and there's such a shortage of physicians that really healthcare in the United States and around the world is a struggling entity. The more I looked into it, the more I realized that medical practices as business units in the United States severely lacked the long-term viability. I looked at 30 different entities, and all of them were financially challenged. That's when I realized that buying up medical practices would never be something to do. But the more I dug into the reason why those medical practices were unprofitable, that's when I realized that artificial intelligence and technology can actually fix this problem. You could use AI to completely automate all of the activities that cause the dramatic spike in costs inside of medical practices. And that is what I founded AdviNOW Medical to do. So that's a short, high-level summary of what brought us to the company that I'm running now, which is AdviNOW Medical.
Brilliant.
We use artificial intelligence to completely automate the clinical and operational processes in medical practices.
Just to go into a bit more detail there, James, around the processes, what examples can you share with the audience about the processes and about the customer journey? How does the AI technology and the service that you've designed benefit the end user?
Well, one of the things that I did when I started to look at medical practices is I did a Six Sigma time and motion study. This Six Sigma time and motion study actually led to the data that I will quote here on out. What I did is I walked into the medical practice with a stopwatch and I started measuring exactly all of the activities that every single person in the practice would do in order to fulfill the job of seeing the patient. And then I put metrics on the output that matter. The metrics on the output are you want to treat the patient appropriately, right? You want to give them a good outcome. Then the doctor wants to get paid at the most appropriate level. And the doctor doesn't want to get sued for doing that, for seeing the patient, right? So those three outcomes we were optimizing. We put values on them on each one of the motion. And what I discovered is that physicians were spending 70% of their time doing things that had nothing to do with their medical license. So that led to the realization that you could use artificial intelligence to do all of those 70% of things that physicians are spending their time on. Well, if you look at it from a patient, what does that mean? Well, if you use a medical practice that has adopted AdviNOW Medical, then a patient would receive a text message before the visit telling them to pre-register. And you're like, wait a minute, that happens today. Exactly. It's no different than any other medical practice today as to the patient's perspective. They receive a text message, they click a button, they confirm their demographics, they confirm their payer information. Then there's questionnaires that come. The big difference between AdviNOW and any other vendor is that the questions, when they come from another vendor, these are dumb questions. Hey, does your grandma have diabetes? Let me answer that question for the 10th time today. What AdviNOW does is it does a comprehensive chart review inside the medical records of the institution. Then the AI will predict every single question that the doctor is going to ask that is unique to that patient. And it will ask every single one of those questions to the patient ahead of time before they ever see the doctor. So normally, without AdviNOW, patients will answer those questionnaires. When the patient arrives at the clinic, the medical assistant will ask all those questions again. And then they get to the doctor, and the doctor hasn't even reviewed those questionnaires. And then they go and ask the patient all the questions again. And so the patients are like, why am I even filling out these stupid questionnaires? They're meaningless. Why does a medical assistant ask me? And why is a doctor? What can these people not communicate? What's going on? When AdviNOW is used, the AI does that, and then it provides a comprehensive summary to the medical assistant and to the doctor. So the doctor can just confirm the key symptomology with the patient, complete the diagnosis, and click a button. So to the patient, they don't notice any difference. The only thing that maybe they would notice is the questions are more relevant. To the doctor, though, they get a one-page summary of everything about that patient that they need to discuss with the patient. Now, instead of their head being buried in the computer and they're answering questions to the patient from the back of their head, they're actually looking at the patient in the eye, explaining to them about their condition and what they need to do to best treat it. This is why there is a 30% swing in Net Promoter Score for clinics that adopt AdviNOW compared to ones that don't. Patients want doctors to spend time with them. They want them to look at them in the eyes. They want them to understand them. When AdviNOW is used, the doctor can do that with freedom. They click on the diagnosis, the AI will scribe a complete SOAP note, and then it will code it. So it has the assessment and plan. The doctor relays that to the patient. It has the code that the insurance company is going to pay, and the doctor will approve it. And then they move on to the next patient. This is why revenue per doctor doubles when AdviNOW is used. Profitability of the clinic goes from less than 3% on average. 3% profit businesses are terrible businesses to greater than 30% profit for that same medical practice. Patients get better outcomes. Patients feel more time with their doctor. Doctors work less hours. Insurance company don't have any claims that don't make sense. Everybody wins when technology is used, and we're really excited to bring that technology to the marketplace.
Some really, really good insight there into AdviNOW. Amazing. work, James. We do have another question for you about your background, and this is what's led you to turn around and grow at billion-dollar companies? What's the common thread between your successes? Because you've got a really impressive catalogue of accomplishments.
Yeah, I mean, really early in my career, I was a R&D developer for Bell Labs, and I had that opportunity to be a core researcher, and I absolutely loved it. But I also had the opportunity to take technologies from the core research lab and find markets for them. And as I engage directly with clients, you can actually help them solve their problems. And that has just become a passion of mine as an engineer. I love to solve problems. It's something that I enjoy. And when you go into large businesses and you take a different look at the problem, you can actually go through and make the client happy as well as you make a great business. When I turn around large businesses, when I joined Freescale as an example, the group was a $700 million group, but it was losing money the first year I joined. As an engineer, I dug in to the actual manufacturing costs. I dug into the testing mechanisms. I dug into the products that we were defining for our customers. And I knew that we had to be leaders in the space. We couldn't just receive an RFQ and respond. Otherwise, we're a Me Too client. If we become the leaders in self-driving vehicles, and we know that this is the solution that our clients need, then we can actually deliver products that they can use. And I'm very excited about doing that and leading with technology, leading with a vision of where the goalpost is supposed to be, not where it is today, but where it's supposed to be, allows you to really drive differentiation and revolution in the marketplace.
Really impressive. Really great to hear that. Thank you so much. That leads me on to another question. What personal habits or philosophies have helped you bridge the gap between technology vision and real world execution?
It's really using metrics as you are analyzing the new spaces. That's really what it's all about. At the end of the day, anybody can have a gut feel, right? But you want to have a scientific understanding about what's possible. And if you don't have the capability to do both, then either you're going to come up with an idea that's going to fail, Elizabeth Holmes with Theranos, or you're going to develop a product that nobody wants. Many engineers who come up with products that nobody wants. You have to be able to merge the vision with the reality about technology. And I think I've been lucky enough to be able to do that in my career.
Brilliant. Thank you so much. We move on to the next segment of the podcast, which goes through the main topic for today, which is breaking down silos in sales and marketing. From your perspective, James, why do silos still exist in many organizations, even with modern technology available?
Yeah, it's very interesting when you use the word silos. That the word silos would assume that each one of the organizational groups has different goals. And as you're breaking down silos, every large organization you'll have different orgs, sub-orbs become fiefdoms. And that is a fundamental problem. However, when you're actually looking at it and engaging, if you can change the goal structure such that everyone has common goals, which forces the different organizations to work with each other, then you can actually create a greater team effect. Healthcare has a massive problem with those silos not working with each other. And that is where AdviNOW, quite frankly, as we were growing, was having our biggest challenges. The medical team would always want to adopt it. The IT team is saying, we're too busy. And the CFO team is like, we love it. And the COO team was like, oh, we got too many things on our plate. Well, if everybody had the same goals, if everyone had the same desires with what their job is supposed to entail, then you would not have those different silos. So it's really setting up the goals to be cross-pollinating and allowing people to work together. That's the key for breaking down the silos.
Brilliant. Sounds like we need different teams to work in the same direction and be part of one bigger team to affect the main outcome. Brilliant. Excellent.
Absolutely.
Okay. How can AI foster better collaboration between sales, marketing, and product teams?
It's really just all information. I mean, ultimately, if you look at a sales team, you look at an implementation team, you look at a marketing team, they should all want to work together. If the marketing team is out there advertising something that the salespeople say nobody cares about, then they could have the most beautiful marketing campaign on the planet, but it's not driving sales. If the marketing team is advertising something that doesn't really exist, and the sales team goes out there and tries to sell paperware, right, slideware, whatever you want to call it, that doesn't bring value to anyone. The marketing team says, hey, we got lots of interest, we're driving lots of leads, but the sales team isn't closing any of the leads. That's a fundamental problem. And then if they have something, but you can't implement it. So the marketing team is marketing, they're seeing the leads. The sales team has the leads, they're closing the leads. But then the customer success team can't onboard those clients in a happy way. Then you're going to see such a high amount of churn, people quitting, that you will never be able to drive ultimate revenue success. So if all three of the teams had a similar goal, which was revenue, low churn, drive, then you could see them working together more such that their metrics are well aligned to the company's overall goals.
Fantastic. Really good. Okay, then. So, what lessons from AI in healthcare can be applied to sales and marketing collaboration?
It's all about giving the same data in the way that it could be utilized to achieve those goals. That data access and that data delivery, it's key. And if you're going to automate processes, make sure that they're automated with the end goal in mind.
Just to probe a bit more further in regards to data, how can one organization become efficient in harnessing the data to help with sales and marketing activities?
Well, you improve what you measure, right? I mean, that's a very famous saying. So the data that you collect has to be the things that you really care about. And with data analytics and a lot of different AI type of tools, you don't really know which data is correlative and which data is not. Well, that's where you go and you grab all data. And many times people can kind of run into, you know, dead ends when they're doing that. So as an example, when I founded AdviNOW, I used a time and motion study to determine what the technology could do across the organization, regardless if it's patient facing, doctor facing, coding facing, payer facing, front end, back end. I didn't want any of those barriers. I just went across the board and I said, I want a time and motion study of where everything is touched. Well, when you do that, you end up with the type of results that we have. So that's the exciting part.
You referenced earlier on about listening to patients as well, listening to the end user. From the work you've done at AdviNOW, what do patients think of the service being delivered now with the use of AI and the different technologies that you've made available?
Yeah, I mean, ultimately, we have if the product you're servicing, the end user does not like it, it will never be successful. So you need to be able to develop a product and get that feedback and have something that's wildly successful. Measuring patients as users, measuring doctors as users, measuring every person in the clinic as a user, you get to see exactly your product's results with them.
Using obviously it's not one size fits all approach. You're creating a personal experience for the end user, for the patient. How important do you think that is in the medical arena?
Well, it can't be done without it. I mean, every single question is customized specifically for that patient. If it's not, then the product is the same as all the other stupid products that are out there.
Okay, looking ahead, what role will AI play in completely reshaping or how companies align sales and marketing with the overall business strategy? What's your take on that going forward?
Well, I mean, there's 100 AI tools out there in sales and marketing right now. There's far too many, and they're all terrible. I've never seen a good one yet. And the answer is not because they all need to be terrible. It's because they're essentially trying to replace sales agents or marketing agents and have them answer emails and write calls and do all this stuff. And maybe we'll get there someday. But ideally, in the sales and marketing, what you want to be doing is exactly the same type of analysis that I did for the operational activities of that medical practice. You want to make the sales agents more efficient. You want to make the marketing team more efficient. You want to make the customer success team more efficient. So automating what they're doing in their day rather than just going and jumping and trying to replace them with AI, that's really what I would say is the best approach for effective sales and marketing AI tools.
Really good pearls of wisdom there, James. Okay, we now going into our third segment, and you'll be pleased to know it's our final segment. We've got 3 questions for you, James. We'll start off with, if you could instantly master any new skill, what would it be?
I mean, if I could instantly become an expert modern coder, I think that would be pretty cool. I could code a long time ago, and I've been leading and architecting and writing patents and doing all that, but I haven't actually sat behind a desk and coded in a very long time. So that'd be something nice to do.
Sounds cool. Okay. What's your go-to productivity hack?
Really, it's just organization. I mean, you can tell a lot about a person by looking at their email inbox. If they're working in an inbox with 10,000 messages and 9,000 of them are read, that person will never be efficient. Doesn't matter what they do.
Great. And if you weren't leading a company, what unexpected career might you try?
Well, I mean, I've got a long list of things that I want to invent, so I would probably just go on to the next event.
Sounds fascinating. Thank you so much. So, James, it's been an absolute pleasure having you here and hearing your insights on AI, your journey with AdviNOW, the collaboration and breaking down silos. For our listeners, remember the future of work is here, and AI is one of the most powerful tools we have to connect people, processes, and ideas. This has been the Planet Elevate AI podcast. I'm your host, Imran Kadri, elevating you to success. Thank you for watching and listening. Thank you.
Thank you, Imran. Appreciate it.